So in this episode of Talking Health Tech today, it's another showcase episode taken from our Talking Health Tech Spring Summit that we held at the end of last year. We hold our virtual summits every quarter for our THT Plus members and for ticket holders that come along, and they're full day virtual events with panel discussions, and they're collaborative. It's kind of like the epitome of why Talking Health Tech was created in the first place, bringing different perspectives together, whether it's vendors or patients or hospital executives or clinic owners, everyone together that's trying to solve meaningful problems in healthcare with the help of technology. And this session, which will be introduced in a second, it's all about that patient paper trail and bringing together some really great insights. It's a session that I moderated about how we go from the manila folders and little bits of paper to where we really want to get to in healthcare with information that's accessible and hopefully help serve more patients and maybe even create some efficiencies within the healthcare system. So here we go. Collaboration starts with a conversation, Team Health Tech. Let's make it happen. This is Talking Health Tech with me, Peter Birch, featuring content and community about technology in healthcare. The use of paper for collecting patient data across Australian hospitals is still predominant. Let's consider for a second the risk to clinical outcomes when the patient information sits on a shelf, at times in many locations, rather than accessible digitally at the point of care. This is session 4 of the Talking Health Tech Spring Summit titled The Patient Paper Trail. I'll be moderating this panel discussion featuring Berne Gibbons, Head of Business Innovation and Partnerships at InfoMedix, Chris Mitchell, Chief Information and Digital Officer at Hunter New England Local Health District, Dr. David Tralaggan, co-founder of Clinical Documentation Improvement Australia, CDIA. To prepare for this session, we posed the question, what are the biggest benefits for frontline healthcare workers of digitising healthcare information? Half of respondents said better patient insights. 46% of people said it saves clinicians time. Only 4% of people think that the biggest benefit of digitising healthcare information is to reduce clinician burnout, and no one thinks it will improve job satisfaction. Let's go to the panel and discuss it further. Got a rowdy bunch of seasoned veterans for this next session here, coming from different perspectives and from different locations as well. So, and I'm going to be moderating this session. So I guess you're in for a treat. You're in for an experience. But look, what I might do, I might give each an opportunity to give a bit more perspective about, I guess, the work they do, but also their experiences with this challenge that we face today with the use of paper for collection of patients' healthcare data. I saw Robert in the chat, we aspiring to a paperless, free-ish world. So I guess that's a good start. Let's go around the room and kind of get some more context on who people are. Chris, I might start with you.
Thank you, Pete. Hi, everyone. Chris Mitchell. I'm the Chief Information Officer for Hunter New England Health. We're part of New South Wales Health and cover the geography from around about Morisset in the south, near Gosford, up to the Queensland border in the north. And we have with it, and the whole geographic area is around about the size of the country of England. And in that, we've got 40 odd hospitals that I support the ICT and digital health, and a whole another couple of dozen community health and clinic locations and things like that. So it's a very, very, very large health service. And I think with relation to today, I've been executing Hunter New England's inaugural digital health strategy, which is all about eliminating the paper. So really looking forward to the conversation this morning. Thank you, Pete.
No, thank you. Look, I mean, it'd be a particularly busy week for everyone in your position in New South Wales, I guess all over the country as well, too. But David, I'd love to learn more about you and this topic.
Yeah, well, hi everybody. Thanks for joining us on the summit today. My name's Dr. Dave Tralaggan. I'm a practicing medical doctor. I work in the ICU, but most of my time is now preoccupied with an organisation that got kick-started out of some experiences I had as a junior doctor, and founded an organisation called Clinical Documentation Improvement Australia, or often referred to as CDIA. And we're partnered with hospitals in every state of Australia. North and South Island of New Zealand and some big names in Saudi Arabia. And we're all about empowering clinicians to deliver safer care to every patient through enhancing the quality of documentation. So excited about this session.
Absolutely. And Bernie, over to you.
I didn't know, Melissa, whether you meant that this is boring and that's why we keep you.
Cure the jet lag and get you.
Oh gosh, yes, yeah. So Bernie
Positive
Gibbons,
vibes, Bernie.
you've already introduced me, head of strategy and partnerships at InfoMedix. I'm also consulting to the agency as well, stakeholder engagement with clinical and digital health standards, and I'm very new, and it's something that I do want to talk about. Founding member at UTS, we've been developing a digital health research collaborative over the last, I guess, 5 years, and has been a dream of the Faculty of Health at UTS. And it's going to be focused around improving experience and the knowledge of our healthcare workers in digital technologies. Very important.
Absolutely. And look, so look, I can see a lot of people looking forward to this session in the chat, and there's different perspectives from the agency, startups, overseas, in different health districts. So I very much encourage participants to help shape this conversation. But I wanted to go to you, Chris, firstly, because, I know that you've seen industries outside of healthcare as well. And we're talking about this point around digitizing information in healthcare in 2022. So talk to me about other industries and your experiences there. Are we just same thing but a couple of years behind? Is it that simple? Is it a little bit more?
Look, I think there's a lot more nuance to it, and there is no straightforward or simple answer. There are so many factors that impact on the digitization of healthcare that just have to be considered. It's every decision that you make, looking at the scale and the size, the complexity, and the challenges in the organizations that we serve. Every decision you make has to be really, really considered. So it's got to be the right decision to start with, but you've also got to bring everybody on the journey with you, and the different stakeholder cohorts and the different the groups that we need to support, work with, and I suppose bring with us from that digital health perspective makes it really, really challenging. So it's a challenging area. I don't know that we're behind. I don't know that digital health necessarily lends itself to some of those more sort of self-service industries that we might see, around financial services or insurance, things like that, where people want to be able to sort of do that on their own time and personally with apps and mobile devices and things. Healthcare is about humans. It's about people. And it really is about that personal experience, I think. So again, I'm sure the conversation will evolve, and I don't want to take up the airtime because I could definitely talk for half an hour on this topic alone. But I do not think that we're a digital laggard. I don't think you suggest that. If you look at some of the super high tech stuff that's happening with precision medicine and artificial intelligence, things like that, they're about as far removed from digital laggard as you can get. So there's a real interesting kind of contrast between I suppose some of the technology and some of the perception I might suggest. So that's and again, every industry evolves in this area at its own pace. I've worked in a couple of different industries, and like I said, I think some lend themselves better to self-serve than others. But being that we're a people business, it's more about people.
Absolutely. I mean, that's such a good point, Chris, about you chunk it up. You look at healthcare overall and some of the advancements and innovations in healthcare. It's not an industry that's lagging behind. There's obviously areas like this part that we're kind of zooming into in terms of the paper component. So I guess it's motivating in a sense. But also I imagine, David, what would be motivating from your side as a clinician is what we were just talking about is being about the people, not just about the clinical efficiencies and all the kind of business stuff. When it comes down to it, this issue of paper patient records, it impacts patients as well, right? Maybe.
Yeah, like at the end of the day, like what's the medical record for? Like it's for helping us know our patients and to communicate between caregivers to care better for our patients. I think, Chris, your line then, it's like we're about human beings caring for human beings. And I think like one of the problems with this discussion is sometimes people come to like the whole digital health question, like really simplistic thinking. It's kind of like, we need a digital record. But my question to them is like, okay, well, let's just stop for a second. It's like, what do you want that digital record to actually do? What problem are you trying to have it solving. And I think like early on, like you go back, like the US with their early adoption, I think a lot of places failed to kind of answer that question. So they had this record, they could all access the record a lot quicker, but it led to like maybe more problems sometimes than solutions. And so I think we are in some degrees behind the US. I've spent some time in the US and done site visits and things like that. But I think the advantage for us in Australia is we can learn from all of those lessons. And I wouldn't necessarily consider us laggards, but maybe leapfroggers. And there's a huge opportunity to, because once you're entrenched in some digital systems, it can be very difficult to unpick. And, watching the market for 10 years, Australia's in a really good position to learn the lessons from others and to leapfrog and go ahead and implement digital health in a way that solves problems rather than just bringing a record for kind of the star insets to a starry light.
I really like that, Dave. That comment about digital leapfrogging. I think that might actually become a reality here in Australia in the coming years. I think that is definitely a potential thing that we might see.
Well, Bernie, we talk about this too from time to time in the THD Plus community and just out and about generally, is that we're not short of people within our little circles of people who agree and nod their head on this kind of topic around, that this is where there's the opportunity, this is where we need to be. But I guess you're also out there speaking to CIOs, hospitals, like players, different people trying to, break into the areas and it's not the same sentiment everywhere. How do you find the sentiment from hospitals and healthcare providers around the country? Is there an appetite for change? Are we there?
Oh, good gosh. Yes. That was rhetorical, right?
I'm
But for
serving
all
it up.
different reasons. I know, thank you. But for all different reasons, isn't it? Like there's private hospitals now finally, after looking at different costing of the big solutions, is turning now to saying, well, at least let's scan medical records in so that we can then have them digital so that we can access the revenue that we deserve for the services that we've provided. And you can't do that. Well, it's difficult with paper. And, during, I can tell you that there's a large hospital in Australia that during COVID lost half of their coders because they didn't want to be in the hospital and going up on the wards. And they looked at it that it was around $65 an hour additional cost to have them totally PPE'd and go up onto the wards. But so if you have a digital record, though, once it's no longer on paper, they can log in from at home and from anywhere. So there we go. Now, straight away, we've improved our healthcare workforce. They're part the health information managers are a very important part of our healthcare workforce. And, I'll probably leave that more to Dave, but we need to look at, the difference between public and private. Is that different reasons for wanting to have the digitized paper? And my thing of late has just been, my whole last 12 years has been interoperability. We need to interoperate. We need to change. We need to have standards so that, we need policy change so that, we will tell the sector that you must follow these standards because it's costing us money as a government to not have you follow these standards. And, because you don't talk to the other systems that we've got in our hospitals, right? I know, Chris. So, the policy part is very important. But while we're doing that, and probably the leapfrogging is a very good example of this, while we're looking at the policy change, what for standards, we can be digitizing the paper because you can't interoperate with paper. There is no way that you can still get to the patient record if it's in paper. It's not there. You can get it in a few hours, just not straight away. Sorry, Captain Obvious hat on there.
No. Well, look, I mean, Chris, I see a lot of, nodding from your side. Is it, it sounds so simple though, to just like let's stop using paper. And you know, we're so what does that look like in reality for you?
About as far removed from it as possible, I have to say. And look, Hunter New England Health took a best of breed system approach, which means we have good digital clinical support in certain areas, but it's completely fragmented, and we have lots and lots of paper. So, as Bernie alluded to, you get it, but a person's actually got to go and pick up that piece of paper and scan it into a system, which often takes a couple of hours, because that is happening, hundreds and hundreds of times every day across a district or our size. One of the other things that I want us to sort of weave into the conversation, and I don't know, Pete, if you can bring those survey results back up on the screen, but that one about the digitisation of medical records reducing burnout at 0%, that one was really that spoke to me, I have to say, because one of the things that I would strongly sort of suggest here is that I don't know that we've done a great job from a digital health perspective about that employee and workforce experience. And I can see that Dave's smiling here and stories for us. But I think one of the things that I've learned in some of those other industries, the IT or the digital technology experience working within the organisation is an important point on job satisfaction and your ability to attract and retain a good and talented workforce. So this actual digitisation of medical records, yeah, absolutely, it's about reducing clinical risk and reducing that fragmentation, but it's just as much about workforce wellness and staff well-being as it is anything else.
I think anything digital health, it's just like any other project. You've always got to bring it down to the basics. What are we trying to achieve? And does our actions help us achieve our objectives? It's as simple as that. And I think so often that's forgotten because there's kind of like this sex appeal, this kind of like starry shining lights. It's like, yes, we're getting a digital solution. Someone's willing to sign off at it. It's so exciting. But we really need to, again, to step back from that, keep like the principles and the objectives at hand. And I think, it's crazy. Like the physician burnout, like in Australia and the States where it's been like better studied, is just off the charts. And it's been on the agenda now for like a decade, but it hasn't been addressed. So, for all the people in the summit, who whether it's the vendors like producing things or it's the implementers on the site, like we need to work collaboratively and be honest with each other and keep asking that question, like, what's the solution we're trying to solve? And does this solve it? And it's not just the solution itself, because, one of my closest friends is like 10 years at Google, and he always tells me, he says, Dave, software isn't about computers, it's about people. And so the implementation phase is just as important as the product itself. So we're always got to keep laser focus on what we're trying to achieve.
I see a lot of good comments and questions in the chat there, and it's I think this topic it resonates with a lot of people. So apologies if I'm not keeping up, and I encourage speakers to jump in after this session and continue to keep that conversation in the chat too. But I noticed that it was, Robert raised a question too, which is kind of to a little bit to what David was talking about too, which is problems to be solved. We've seen an announcement, I guess, for those not familiar. Here's potentially a scenario where we rip out all the old EMRs and put in one standard one across all of the states. No. Is that going to stop us from using paper? I'm not making a point around the decision and everything, but just conceptually around, is it it doesn't sound like it's a systems thing that's going to fix it necessarily in and of itself, right?
Do you want to go first, Bertie, or shall I?
So I will just comment on that. I think Kim's added something here as well, Kim Gilbert, that we should stop having just technology. We can't keep throwing technology at this wicked problem that we have. We need to think. I'd love to get everyone in a room. We talk about this, Pete. My dream would be to have a round table, massive round table, where with whiteboards and the like, and we talk about where we're at and and where we want to go, where we were, because that's a good story too. But, how far we've come, but we haven't come far enough to actually make the access to the data. Researchers are in a world of pain because they can't get access to research data that is on paper, so that, we're behind in so many ways. Let's all get together and plan a way out of this. Chris?
Yeah, absolutely. And look, I saw quite a number of comments come through. They're all very insightful. And I don't know if I can address them in the next couple of minutes, but we'll give it a go. So there was a question about the recent announcement this week with regards to Epic and Hunter New England. And yes, I think absolutely it will make a difference, but it's not a silver bullet. It's not the panacea. We will clean up a great deal of the paper with the first wave implementation of this particular EMR. There's no doubt about it. But it's not going to remove every piece of paper in Hunter New England Health with the first wave. That's absolutely not a realistic view. There will still be plenty of work to continue that digital transformation after the initial wave. It'll be a foundational starting point. And I think probably just the other point that I'd like to make about this one is that I really see this as much of a staff engagement and well-being exercise as anything else. And Pete, I want to almost put a challenge on the table here with that survey result. I'd like to have another look at that in a couple of years if we can go and resurvey the Hunter New England clinicians after we do the implementation to see if the new system has actually helped or has indeed made the work-life burnout stuff even worse. I think that would be a really, really interesting topic. And from my own perspective, I want this to be a great experience for the staff. My mission as the Hunter New England Health CIO is to reduce the friction between the people and the technology.
Yeah, absolutely. We'll have to go. Sorry, Chris. Sorry, David. You were just agreeing wholeheartedly.
Yeah, we're all just going, yeah.
Yeah. Just the chat on the side is going pretty hard. I'm gonna have to reflect on some of these points. I wanted to tie together some of this point that Melissa raised around, and I guess it's kind of like trying to leverage some other industries, and that's not the one. But there's the points around the green effect. I guess that was here we go. Will we get greater traction, like as in funds and regulation and transformation support, if we start joining better care with digital health agenda with the green agenda, basically trying to kind of chunk these points up. Is tied this to sustainability and clinical governance frameworks as well. So it's an interesting point around if health impacts everyone, and there's some of these issues around environment and other bits and pieces too. I guess at a bigger scale, there's got to be that kind of connection too. So that's a really interesting way to think about it. Yes, Bernie?
Can I Liz Keane has made a very good point here, something that I was talking actually to GS1 a few weeks ago, and they brought this up as well. Maybe what we should be doing is offering green credits, like credits for the dilution of paper in healthcare. And that would be something I think that the person on the street, I'm always saying, how about we all walk outside and talk to people about where do you think your health records are stored right now? Because they think that they're probably digitized somewhere, and in the same way that their bank records are, or maybe with Optus or something. No, let's not go there. But who knows where they are now? Gosh. Who anyone see them leave? But, I think that if we were to talk to the people on the street, they will say, well, I thought that you were looking after my health records, Prime Minister or Minister Butler. And, we need to do more about, bringing it to their attention. And younger people, are interested in the green credits. People like you, Pete.
Could I sort of maybe comment there? It's a great point. I think it was Melissa that raised it. I think there's something to evolve here. So I think if I look at the sustainability agenda, I actually see a lot of parallels to where IT and digital was probably 10 or 15 years ago. It was sort of something that happened in the back room, and nobody really knew about what those boffins were up to, sort of thing. And I think sustainability is in a similar space. If we look at the scope 1, the scope 2, the scope 3 emission type stuff, I don't know that there's an enormous amount of understanding about it in C-suites globally with regard to that. So I think people are coming to grips with the whole sort of sustainability angle, and things are starting to shape up, certainly within the New South Wales government around this stuff. But there's still a ways to go, and I think it's a really interesting topic and something I will keep my mind on, and have been keeping my mind on, in fact, as we talk about this paper stuff and what is the impact and the linkage then into sustainability, because paper is absolutely one element of waste coming out of hospitals. But let's talk about KimGuard and plastic and single-use surgical instruments and all that kind of stuff as well. They might actually be a better starting point than the paper, perhaps.
Yeah. Now, look, I see a great point that Grace has raised in the chat too around the implementation and adoption stage, and we've got some dedicated sessions on implementation and everything later in the day too. So, but that's such a good point too. And I guess the purpose of this session isn't to solve the issue and all of a sudden make all of the records digital, but it's to really start that conversation and kind of take some next steps. So I guess
what it was.
That's how I got you
Why are we all here, guys?
Sorry, Bernie, that's how I got you on in your busy schedule. But if we were to kind of summarize, perhaps then, since we've got the 100 and something people who are watching live now, and there's different perspectives, if there's perhaps final thoughts or recommendations and ask, or something for people to do to help, because I don't think the four of us on the screen is going to do something. We've been talking about it for 150 years. So, you know, to then broaden it out to the ecosystem. Final thoughts for each of you or recommendations for others to help push this agenda along? Maybe Bernie, I'll start with you.
The bell's going, so I'll let everyone else answer first.
Oh, there's a bell. Okay. Chris.
We keep making it about the people. It's about the patient record. It's about the participation of the patient in their own care and indeed their own carers, and making stuff better for our workforces and our community. So that ruthless focus about, you know, making sure that digital is working for the people that have to use it, I think is absolutely top of agenda as we continue down this path to eliminate paper from our clinical care.
So true. David.
Probably my last thought is that, like, digital health is kind of like not different to any other part of the business. It offers solutions, and does the benefit outweigh the cost, and does it meet the objectives? And just stripping it back.
Yep, good one. And Bernie.
Yeah, thank you. I just want to go back to, you know, like I think we've all just agreed, but to Grace's point, and I know it's one that is shared, we can't keep putting off, however, transitioning or adopting digitisation of the patient's medical records or the way we do things, and it should not be so disruptive. It should be that it's something that, wow, this is going to make such a difference to not necessarily even to me as the caregiver, but mainly to the outcomes for the patient. Because if I'm, you know, part of a multidisciplinary team's plan, as the guys were talking about it earlier, you know, is without being able to have access to that, if the records, you know, locked somewhere, at another place, I can't improve the outcomes for that individual. So I want us just to start to think differently, because, you know, the healthcare workforce is burnt out because they are running all over the hospital trying to get information from all different places.
Now, look, there's some great final thoughts there, and we're going to have to wrap up this session, but it's not going to be the last time that we talk about it. And I'm sure we'll rope you all in for a future summit session and perhaps something else too across the ecosystem. Bernie, Chris, David, really appreciate your time.
Thank you very much, Pete.
For more content and community about technology and healthcare, visit talkinghealthtech.com.